It seems like all the other locum psychiatrists are pretty good golfers, and so if I want to join them on a Saturday or Sunday, I better learn how to golf.
Whoa! I wanted to make sure I got it out.
I'm Dr. David Weiss. I'm a CompHealth psychiatrist, and I work in Locum Tenens. I've rotated through all the medical specialties. I've practiced in general internal medicine, general surgery, obstetrics, emergency room, and what I found was in psychiatry, I was really able to spend time with patients, get to know them, and help them with their lives. I had worked in an outpatient private practice group for about the past 5 or 6 years, and my partners and I just got fed up with handling the day-to-day aspects of managing a practice. We found that we were spending more times in the business side of medicine than we were treating patients. It was at that point that I was looking for alternative ways to practice. I talked to several people, including my father, who had done locums psychiatry for 10 years and told me about CompHealth. His experience was so positive that I called CompHealth, and right away they were very responsive to my needs. They knew what I was looking for, and they helped get me started on this path. There was a time when we closed our outpatient psychiatric practice that I had to really ask myself, do I want to continue to be a doctor? Because CompHealth allows me to focus on treating patients, I've decided to stay in medicine. When a patient comes into the hospital, I don't have to worry about whether or not they're indigent or whether or not they're on a managed care plan that I don't participate on, or whether or not they're Medicare or Medicaid that I don't necessarily participate on. CompHealth takes care of the malpractice, and they use a top insurer, so I know that I'm protected on whatever site I go to. I can focus totally on just treating the patient, and that to me is worth its weight in gold. I think locums is a great opportunity for a young graduating resident. It gives them the opportunity to try out practicing in a bunch of different settings, even different states, but certainly different clinical settings, and it gives them the opportunity to figure out what they really want to do before they settle into perhaps a long-term practice. As a CompHealth doc, I basically don't have all those administrative hassles that I had when I was in practice. If I feel like working, I can work. If I don't feel like working, I don't have to. Again, you can't do that in private practice. After a week of working in the clinic, usually a good tee-off shot feels the best. If you can just hit it as hard and as long as possible, that's what really feels good.